WFAA-TV, the spirit of Texas. This is Good Morning Texas in high definition.
Do you have muscle and joint pain? Do you have no energy? Have you been told that you have fibromyalgia and there's no cure? Do you resolve to take control of your health in the new year? Dr. Stephen Hotze has some great news for you today. He brought with him one of his patients, and that's Rebecca Renaud. Rebecca, we'll get to you. Actually, let's start with you about the symptoms that you were experiencing, because so many people come on here, Dr. Hotze, with so many ailments, and you fix them. And you make them feel better. Rebecca, you're smiling, so I'm guessing you're feeling better. He does fix them. Talk about how you sought Dr. Hotze out and what you were feeling.
I was experiencing fibromyalgia, muscle, joint pain, not sleeping, no energy, overweight for 15 years until I went to the Hotze Wellness Center.
That sounds like a laundry list of horrible, disabling ailments to be having for so long. Why did you wait so long? Did you think you couldn't be helped?
During those 15 years, I saw 6 to 7 doctors, and those doctors put me on antidepressants, pain medication on top of pain medication. The last doctor I went to was getting frustrated with me because he's suggesting that I do all this stuff and I've already done it, so he was getting frustrated. So he concluded with, well, maybe you should go to a dentist and get a mouth guard.
That doesn't make any sense.
I was so frustrated. I left, I cried, the light bulb went off. I remember Dr. Hotze being on Good Morning Texas back in 2006, 7, and as soon as I got home, I picked the phone up and called the Wellness Center, scheduled appointment, went down there 2 weeks.
Yeah.
And ever since then, I feel fantastic.
Yeah, Dr. Hotze, we hear this time and time again when your patients come on that mainstream doctors haven't been able to help. She's been misdiagnosed, she's been medicated. So let's talk about fibromyalgia. What is it, and what was going on with Rebecca when you saw her?
Okay, well, fibromyalgia is really a description, isn't a diagnosis. It's a Latin description of an English term. When you go to the doctor, I've got joint and muscle aches and pains and I'm tired all the time, doctor. And they'll run $1,000 worth of tests and come back and say, you have fibromyalgia. And you think, well, gosh, at least I know what I've got. What does that mean? It means you have joint and muscle pain. You go like, that's what I told you I had. What causes it? Well, you don't know. It's idiopathic. And I say it's idiopathic because the idiot can't figure out the pathology. He doesn't know what's going on. So he goes, well, you just need antidepressants. And they put the women on the antidepressants and anti-anxiety medication, sleep medication, pain medication, and they never get well because the underlying problem hasn't been addressed. And commonly, 90% of the time the problem is hormonal decline, particularly decline in thyroid hormones, not having enough thyroid hormones, which govern your body's metabolism. You're not getting enough into your cells. So when Rebecca came to the center, we've heard this. If we've heard this once, we've heard it 20,000 times, these same symptoms of women, and we know that the problem is hormonal. And she had gone through early change of life in her early 40s, and the doctor said, you can't have change of life at 40s. We don't believe it. She made him do a blood test, and guess what? She was right after seeing 3 doctors.
So obviously there's lots of symptoms here that are a common denominator here with the chronic fatigue syndrome and the fibromyalgia. These are the symptoms that so many people watching might be experiencing, and they think they have to go to a doctor, they might be put on medications, but hypothyroidism symptoms are similar. Is this right?
Well, this is exactly right. Fatigue, inability to think clearly, joint and muscle aches and pain, depression, stomach disorders, recurrent and chronic illnesses, tingling in the hands or feet, cold sensitivity. As a matter of fact, the best test you can have for hypothyroidism is check your body temperature. It should be 98.6. Inevitably it'd be in the 97s or 96s. So what we do is we put people on natural desiccated thyroid, not synthetic thyroid, and we put them on their natural hormones, vitamin program, eating program.
And this is the best news, Dr. Hotze. I know you're holding a complimentary webinar on how to achieve and set these goals. And this is going to be next Wednesday, December 18th at noon. So we can find out more about this and more about Rebecca's story by registering to hotzewc.com. And you can get a free copy of Dr. Hotze's book at thyroidanswer.com/GMT. The Hotze Health and Wellness Center is located in Houston, 281-698-8698. Hotze, HWC.com is the website to know.